Should diabetics fast? Video has been seen by 1.7 million people with lot of comments and questions. So answering them right now. 17 लाख लोगों ने ये वीडियो देखा है. Should diabetics fast? उसके कुछ comments questions लेते हैं. Number 1, I don't agree. Actually, diabetics should eat fruits because research says fruits does not increase insulin, glucose or calories. Fruits have fructose and they don't increase blood sugar level at all. Diabetics should have more grapes, mangoes, etc. Such a incorrect understanding. Very, very wrong. Because fruits, once you consume from here, go to the stomach, get broken down, go to the liver, and in the liver, the fructose gets converted to glucose. लिवर में फ्रुक्टोज का ग्लूकोज में कन्वर्जन होता है. जो भी एक्सपेरिमेंट आपने देखे अब तक जिसमें फ्रुक्टोज लिया और डायरेक्टली खून में डाला और देखा कि ग्लूकोज नहीं बढ़ता है, वो सब इनकरेक्ट एक्सपेरिमेंट्स हैं. दोज आर ऑल इनकरेक्ट एक्सपेरिमेंट्स. आई हैव गिवन अ काउंटर वीडियो ऑन दैट विच ऑल्सो हैज बीन सीन बाय 1 million people. Next question. Diabetics has less insulin, then why are they at risk of heart? Diabetics, most of the type 2 diabetics will be surprised to know they have high fasting insulin, not low insulin. They have high insulin resistance. Insulin resistance ज़्यादा है इसलिए ज़्यादा इंसुलिन बना रहे हैं और वो ज़्यादा इंसुलिन आपके हार्ट आर्टरी, ब्रेन आर्टरीज में जाके ग्रोथ करवा रहा है. इट इज़ इंक्रीजिंग द ग्रोथ inside your brain and heart arteries. That's why making you prone for heart attack and stroke. After a meal, 5 to 10 times insulin is needed. That can be less in many diabetics. काफ़ी diabetics में खाना खाने के बाद जो 4, 5 से 10 गुना इंसुलिन लगता है उसमें कमी हो सकती है, लेकिन फास्टिंग इंसुलिन ज़्यादा ही रहता है. Third question. Diabetologists suggest metformin as a gold standard drug which squeezes pancreas to get more insulin. But here we are saying less insulin is good. So 2 corrections in this question. Number 1, metformin acts on liver. Metformin doesn't act on pancreas. Point number 1. Point number 2, less insulin. Let me give you another example. Is your heart rate, your waking up heart rate, which is called resting heart rate, if it is less, it means your body is more fit. जितना आपका रेस्टिंग हार्ट रेट कम रहेगा उतना कम हार्ट बीट्स में आप दूर दूर तक खून और ऑक्सीजन पहुंचा पा रहे हो. इसलिए जितना कम हार्ट रेट रहेगा उतना आपका हार्ट ज़्यादा एफिशिएंट है. दैट मीन्स योर हार्ट इज़ मोर एफिशिएंट. सेम गोज़ फॉर इंसुलिन. If you need more insulin to push the glucose into the cells, it is because there is insulin resistance. That's why more insulin is not good. Less insulin is good. But less also should be between 2.6 to 6 milli-IU per liter. Below 2.6 could mean you have other problems of beta cells, which is taking you towards type 1 diabetes. So very low insulin is not good. Ideal is 2.6 to 6 insulin, and most of the type 2 diabetics have more than 6. What about diabetes medicine during fast? Can they be taken or not? Of course not. फास्ट के दौरान डायबिटीज़ मेडिसिन नहीं लेनी है. इनफैक्ट रात का इंसुलिन जो है उसको भी आधा कर लेना है. The night insulin also needs to be reduced by half, and during the day if there's any insulin or tablets it should not be taken. You keep checking your random sugars after 3 or 4 hours. If it goes above 180, you can take half a tablet under medical guidance. Medical guidance लेकर ही करना है. इसीलिए fasting under medical guidance करना है. Diabetics should fast under medical guidance. Please don't try stunts on yourself, and that's a very important warning for all. I am thin, underweight. Can I do fasting for diabetes? What should I do to reverse my diabetes? No fasting for underweight people. Underweight people need to blow up the muscle, increase your muscle, and try to reverse your diabetes for underweight people. Another question, will body move towards ketoacidosis during the process? Ketoacidosis does not happen to the degree it can happen in a type 1 diabetic where you need to admit them. But some degree of ketones will be generated inside the system and they are good for you because they supply energy to you. Alright, so don't worry about ketoacidosis. And one more very important question, rice and wheat, should we avoid it completely and only stick to millets? So the answer is, you can have rice, you can have wheat, you can have millets, you can have all the grains, but keep checking your sugars as to which grains you are responding to better. And over a period of 3, 6 months or 1 year, you should be flexible and strong to handle all grains. आज के लिए इतना ही, फिर मिलेंगे ब्रेक के बाद. This is enough for today. We'll meet again after a break.